So thank you very, very much for both of those wonderful presentations. I'm going to be another 180 degrees off in another direction, as you can see from the title, After Visit Summaries in Community-Based Dental Clinics in Maryland. And first of all, I want to make sure that you understand that I didn't do all of this alone, but had many, many colleagues working with me on this project. And what we actually did was to do health literacy scans of community-based dental clinics. And you're probably wondering, well, how does that fit in with this discussion today? But what we actually did, based on work by Rudd and Anderson, the health literacy environment of hospitals and health centers and AHRQs, health literacy universal precautions, and our overall purpose was to determine the user-friendliness of community-based dental clinics. So these are city and county and federally qualified centers, health clinics in the state of Maryland. And we conducted a feasibility test. In other words, can we actually do this? Will we be accepted by the dental directors and the managers? And what we ended up doing was getting permission from 26 of 32 of the clinics. And it was all done voluntarily on the part of the dental clinics and managers. So health literacy scans of community-based dental clinics, we use all kinds of methods, both taken from Rudd's work and also federally qualified, not federally qualified, from HRQ's assessment, and did interviews with the director. We did technology assessment of electronic health records, print materials assessment, including printed forms, and this is especially that is relevant to this conversation, patient interviews, as well as mail surveys of both the providers, all dental providers there, to find out what kind of communication techniques that they were actually using. So, and this is just a schematic, which is probably difficult to see up there, but you can see that we actually did this in 3 different sessions, both from the pre-visit to on-site visit and post-visit assessment. And this health literacy environmental scan is really a part of a statewide health literacy assessment that we did that focuses on prevention of dental caries or tooth decay. And what we found is that the study confirmed the feasibility of being able to do this in community-based dental clinics, and I think it provides guidance for extending the Rudd et al. And AHRQ guidelines into the dental environment, maybe not only just in community-based clinics, but also probably in private practice. So the results of this that are relevant to this conversation. Technology assessment included website, phone system, and use of electronic health records, and educational DVDs and videos. 18 of the 26 dental clinics actually use electronic health records. That's not bad, and that's a good beginning for our discussion. Of the 18 who use electronic health records, only 3 are actually integrated with medical records. And those 3 clinics were all under one umbrella of a federally qualified health center. Now, this really shows that oral health is not considered an integral part of health. And I think you can see that this is really the approach that we have in trying to deal with these kinds of problems. And, you know, we really have to put this body back together because lack of integration causes terrible barriers, both for the patient and for all kinds of providers. Decreasing early childhood caries, which we're really interested in, we need MDs, nurse practitioners, we need PAs to counsel patients and to provide fluoride varnish on infants because we know how to prevent this disease, which is what Benoit said earlier today. The other, and there are many, many other examples, but the other example is that actually medicine needs dentistry in decreasing periodontal disease because it's huge impact on controlling diabetes. So that's sort of an aside, but very, very important as far as I'm concerned that we've got to have the medical records integrated with the dental records and vice versa if we're going to treat the whole patient and if it's going to be patient-centered. So the results on the printed forms, these are consent forms, health history, post-op instructions, were assessed using SMOG, readability formula, obviously to determine readability. Collectively, the forms were rated between the 9th and the 16th grade level. This is a long way from the recommended 8th grade level or below. Forms tended to use very complex dental and legal terminology, and obviously were more to protect the facility or providers than to help the patient understand what was going on. So specifically relevant to this roundtable is we found no after visit summaries in any of the 26 clinics. Thus, the real title to this presentation should be the absence of after visit summaries in community-based dental clinics in Maryland. Now, you have to understand is that I have received medical care from Kaiser Permanente for many, many years. Nobody that goes to Kaiser can leave the facility from a medical appointment without having a patient summary with almost everything on this. And I have to admit to you that why I never connected that I get this patient summary with the fact that we didn't even look or ask for, but there were none anyway, patient summaries in these clinics. And then when I thought further about this, I thought, I've been to 4 dentists in the past year, 4 different dentists in the past year. I don't have one after patient summary at all. I think we have a long way to go here in dental health. So despite the availability of guidelines for developing AVS from CMS, dentistry has not, at least to my knowledge, I could be dead wrong, have exhibited much interest in this potential activity that could make dental facilities and patients more health literate. So I thought, well, I think I'll check around to a few other places to see it's not just my experience. So I contacted a first-year pediatric dental resident who actually is practicing or doing a residency in a hospital in Philadelphia. So it's, low income, almost everything like what we were seeing in Maryland. And I asked her, are your medical records, remember, she's in a hospital, are your medical records integrated with dental records? The answer was no. And then she went on to say, and I won't read the first part of this to you, but I will read the bold. I like bold also. Unfortunately, it seems like we tend to do a lot of afterthought dentistry, meaning our attention is focused on what we did to treat the problem and not necessarily what we should be doing to stop it from happening in the first place. And this goes on extensively, I think, especially in pediatric dental care, that we focus on fixing the problem of the moment, but don't do enough probably to actually help. This is, in my view, after visit summaries are something that we haven't even started on in dentistry, but something that has great potential. So what are our challenges and opportunities? And this is basically, I think this is an exciting area that dentistry and dental public health should be getting into, and trust me, I will be. I think it's an appropriate use of electronic health records, and I think it can assist dental facilities to become much more health literate organizations. And clearly, I see it as a potential for helping patients to also become more health literate. For example, not only can we have everything down there that is listed down below, to provide additional opportunity to people. But keep in mind that of all of the clinics that we looked at, the majority of the patients are low income. And unlike in New York, where everybody has a phone, the folks in Maryland must be a lot poorer because they don't where we are in Maryland. And in fact, about 20% of them don't have any phones at all. And we have to rely on other means. But I think, and also knowing that that some of these folks probably can't read very well, which means we would have to go over this with our patients. But I see it as an opportunity where we can definitely use it to our advantage and to the patient's advantage, and help, quite possibly, to help decrease. It's one more tool that we can be using that we aren't now using. But it's something I think we certainly should be looking into. And that's it. Thank you very much.